Your thyroid is attacked every single day, whether you realize it or not. I'm not referring to the attack from your own immune system, which does happen frequently to thyroid patients, but rather to the barrage of chemicals and toxins you encounter on a daily basis. These include dioxins, BPA, PCBs, pesticides, phthalates, heavy metals, and more. These substances all act as endocrine disruptors, which can and do negatively impact thyroid function. In fact, some of these chemicals sit on thyroid hormone receptors and prevent your own thyroid hormone from doing its job. It sounds awful, and it is, but for the majority of healthy people, it isn't a big deal. Due to the way thyroid hormones affect various bodily systems, thyroid patients may find it more difficult to eliminate these substances than the general population. However, most healthy people can tolerate a reasonable exposure to these substances and have no trouble doing so. What are the two implications of this for you? The first is that you should exercise caution when avoiding these substances in the first place. And the second is that assisting your body in getting rid of these dangerous substances may provide you with a great deal of relief and a decrease in your symptoms. Today, we're going to talk about 5 simple things you can do right now to do just that. The first is to sweat more frequently. Studies have shown that sweating is the body's preferred method of eliminating toxins. So if everything else is equal, your body will preferentially eliminate toxins through your sweat over some of the other pathways we'll talk about. But here's the problem. Sweating is difficult for thyroid patients, and having a thyroid condition also makes it less probable for your body to perspire. The good news is that you don't have to rely solely on exercise if you want to work up a good sweat. One of the easiest ways to do so is by using a sauna, which not only helps you sweat but also has additional benefits to reduce stress, sleep, and even weight. Low thyroid states cause fatigue, which means you're probably much less likely to exercise as well. The first kind of sauna is a classic Finnish steam sauna. Warms you from the inside out. They typically need to be set to a temperature that is far higher than the kind of sauna we will discuss next. A far infrared sauna is the second kind of sauna to take into consideration. Both types of saunas can help you work up a sweat, but I would advise sticking with a far infrared sauna because these saunas use light therapy to heat you up from the inside out, which often results in a deeper sweat than using a Finnish sauna. Additionally, the far infrared light inside of them offers additional health benefits. The second thing you want to do is improve lymphatic drainage because your lymphatic channels don't get the attention they deserve, especially when it comes to detox. Your arteries and veins transport fluid proteins and cellular waste throughout your body, and both types of saunas are effective at activating heat shock proteins that enhance detoxification pathways by assisting in protein folding. Furthermore, both types of saunas activate cytokines that can reduce inflammation throughout your entire body. If you have access to one, your goal should be to spend 60 minutes overall each week, ideally divided into multiple sauna sessions of 15 to 20 minutes each. They serve as a purification. The lymphatic system is not under pressure, so your body won't automatically move lymphatic fluid back into circulation without your help. This is your chance to intervene and change things. The first way is through exercise and muscle contraction. Any movement of your muscles will increase lymphatic pressure and improve lymphatic flow and drainage. The lymphatic system works as a network to bring things back into circulation, so they can re-enter that circulation and be eliminated by your liver or your kidneys. The second option is massage treatment. Massage therapists are trained to provide massages that improve lymphatic drainage, so feel free to use this as an excuse to have a massage. Even basic exercises like walking can accomplish this, but lifting weights and exercising is particularly beneficial. The final technique that you might attempt is dry brushing. In essence, dry brushing is a type of body massage that uses dry brush bristles to exfoliate the skin and improve lymphatic drainage. It can also lower stress levels and possibly improve skin texture. The fourth thing you can do is to stretch frequently. A big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication. So if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts in the comments. Your support truly helps us grow. Now, let's get back to the video. And yoga is the fifth option. These are rather self-explanatory, as just about any movement or exercise will improve this process. Being constant is the key to success, and the third step is to promote liver function. Your liver, which is packed with proteins and enzymes that aid in the breakdown of almost anything you come into contact with, including food and even prescription drugs, is regarded as the body's primary detoxifier. It offers a direct path of evacuation through your bile ducts, in addition to aiding in the chewing through of toxins and other substances for excretion. However, regardless of how you look at it, it also happens to be the primary location for the creation of T3 thyroid hormone. As a thyroid patient, maintaining liver health is one of the most crucial things you can do. The question is, how can you make sure your liver is functioning well so you can benefit from all of these things? In the past, doctors have done this by examining a few liver function tests, such as AST and ALT. If any of these enzymes is excessive, it means that your liver is stressed or damaged. Fatty liver disease from insulin resistance is currently the most common cause of liver stress and damage. Fatty liver disease is more common in thyroid patients than in the general population. If you have access to your AST and ALT levels, check that they are both less than 20. Any value higher than this could mean that your liver is under stress and may be damaged. While AST and ALT are useful, they only tell you whether your liver cells are damaged. They don't tell you how active the proteins and enzymes in your liver cells are. The good news is that there are still ways to enhance the function of these enzymes, even if you are unsure of their exact level of activity. The first step is to eat the correct meals, which are foods high in sulfur. Cruciferous plants such as cauliflower, broccoli, and Brussels sprouts give your body sulfur-containing substances called glucosinolates. Thyroid patients should make an effort to include at least one serving of cruciferous vegetables in their diet each day. They should also not be concerned about the goitrogens present in these substances, since this quantity can be decreased by simply steaming their vegetables before eating them. The second thing you should do is increase your intake of spices, particularly ginger and turmeric, which have been demonstrated to have anti-inflammatory properties and may promote detoxification. I suggest adding these spices to tea or smoothies to help the liver's pathways. But you may also try making golden milk. Taking vitamins to help your liver is the third option. As your thyroid regulates the kinetic movement of your bowels, the fourth item on the list is making sure you have regular bowel movements. My top 3 recommendations for thyroid patients are milk, thistle, NAC, and calcium D-glucarate. Constipation is common in thyroid patients. Why is this important? Since your stool is another important pathway for the removal of toxins, your body tends to eliminate fat-soluble toxins through it and water-soluble toxins through your kidneys. Constipation causes your stool to remain in your body longer, which means those same harmful substances remain there longer. Additionally, constipation can harm your gut microbiota, which will compromise hormone balance and T3 levels. Having at least one productive bowel movement every day should be your objective as a thyroid patient. If you think that's not possible, try these first. Make sure your thyroid is functioning at its best and that you're taking adequate thyroid hormone. Constipation can often be resolved by simply starting the appropriate kind and dosage of thyroid medication. If the problem persists, you may also want to add vitamin C and magnesium citrate supplements, which will aid in bowel movements but not address the underlying cause. Third, check for overgrowth bacterial and fungal syndromes, which are especially common in thyroid patients. Fourth, maintain gut health by taking probiotics, and L-glutamine. And fifth, if you're still experiencing issues, try taking supplements that have a prokinetic effect on the bowels. These supplements actually help with peristalsis, which propels the stool forward. Because they experience a decrease or a slowed down bowel movement, you might discover that you require antibiotics to address this issue. To assess the quality of your stools, use the Bristol stool chart as a guide. Your stool should be classified as type 4. Supporting kidney function is the fifth action you can take. Despite being a relatively small mass in relation to other organs in your body, your kidneys get between 20 and 25% of the blood flow from your heart, because, with the exception of a small number of people who have chronic kidney disease, they serve as the filtration system for all of your blood. The majority of thyroid patients do not actually have kidney damage, but this does not mean that they are not causing additional stress to their kidneys. People with thyroid disease frequently consume foods high in caffeine, sugar, and dehydration, and medications and supplements can cause further unneeded stress on their kidneys. When you combine this with the fact that 75% of adults suffer from chronic dehydration, your kidneys are likely working overtime even if they are not damaged. The simplest and most straightforward thing you can do is to simply drink more water. And while doing so, stay away from drinks that encourage dehydration and have high caffeine content. The amount of water you should drink is a topic of much discussion, but here's what I suggest. Try to drink at least half a gallon of filtered water every day, or enough that your urine runs clear at least once a day. If you're concerned about kidney damage, you can get a few simple lab tests to make sure that doctors don't often overlook it, but it never hurts to double check. Completing these 5 steps can almost instantly improve thyroid function. But I would also suggest looking into thyroid support supplements if you want to increase that spike even more. In conclusion, detoxing your thyroid is a crucial step in maintaining optimal health and well-being. By focusing on natural, holistic methods, such as incorporating detox-friendly foods, reducing environmental toxins, managing stress, and supporting your body with the right supplements, you can help restore balance to your thyroid function. Remember, the health of your thyroid is interconnected with many aspects of your body, including your metabolism, energy levels, and even mood. By taking proactive steps today, you can empower yourself to feel better and lead a more vibrant life. Always keep in mind that detoxing your thyroid isn't a one-size-fits-all approach. What works for one person may not work for another. It's important to listen to your body and, if needed, consult with a healthcare professional before making major changes to your routine. Whether you're looking to improve thyroid function, manage symptoms of hypothyroidism or hyperthyroidism, or simply support overall wellness, these strategies can make a significant difference over time. We hope you found these tips helpful and informative. If you enjoyed this video and want more health insights like this, please don't forget to like this video, share it with others who may benefit, and subscribe to our channel, Health Angel Solutions, for more expert advice on living a healthier life. Your support means the world to us, and we can't wait to continue guiding you on your wellness journey. Stay tuned for more videos, and remember, your health is in your hands.